So hello everyone, welcome to Ask Me Anything session on breastfeeding. Myself Dr. Tanima Singhal, and today I am live with you all to take your questions and to answer the questions which have already come from my mother's community. So I'll answer the questions which you all have already sent, and then later on I'll answer the questions which are coming live here on the live. So let me start with the questions which have already come. And you can write in the Q&A box if you have any questions so that I can answer them. So just give me 1 minute so that I can open the questions. Question is from Mrs. Shama. मेरी 5 months की बेबी है जो जब वो 2.5 months की थी तो उसने अचानक मिल्क पीना छोड़ दिया, बस सोते हुए दूध पीती है, प्लीज हेल्प मी। तो देखिए 5 months की बच्ची है, 5 months के बच्चे बहुत डिस्ट्रैक्टेड होते हैं, तो आपको ये कोशिश करनी है कि आप डिस्ट्रैक्शन कम से कम करें। और उस चीज को आप कैसे वो कर सकते हैं कि एक तो कोशिश करिए कि बहुत ज्यादा शोर ना हो आसपास। और छोटे बच्चे ना इवन छोटी छोटी आवाजों से बहुत डिस्टर्ब हो जाते हैं, तो आपको कोशिश करना है कि आपका जो एनवायरनमेंट है जहाँ पे आप बच्चे को फीडिंग कराते हैं वो जगह थोड़ी शांत हो, जहाँ बहुत ज्यादा शोर ना हो। अगर आपका एक जॉइंट फैमिली है तो कोशिश करिए कि आप बच्चे को कहीं अलग जगह पे फीडिंग करा पाए, क्योंकि बच्चे छोटी छोटी आवाजों से डिस्टर्ब हो जाते हैं। दूसरी चीज आपको यहाँ पे ये भी ध्यान रखना है कि बच्चे दूध पीते समय माँ से बात करने की कोशिश करते हैं, कुछ बैबल करते हैं। तो अगर बच्चे बैबल कर रहे हो तो आप उनको, जब बच्चे दूध पी रहा है उस समय आप उसको रिस्पॉन्ड मत करिए, बट जैसे ही बच्चा दूध पी करके फिनिश करे उसके बाद आप बच्चे के साथ खूब खेलिए। इस तरह से आप बच्चे को सिखा रहे हो कि बच्चा अभी आपको दूध पीना है, अभी आपका खाने का टाइम है, उसके बाद हम खेलेंगे। तो इस तरह से आप अपने बच्चे का डिस्ट्रैक्शन अगर कम करोगे तो आपका 5 months की बेबी वापस दूध अच्छे से पीने लग जाएगी। 2.5 months पे क्यों उसने अचानक दूध पीना छोड़ दिया? क्योंकि 2.5 months पे यूजुअली ग्रोथ स्पर्ट आते हैं। तो जब ग्रोथ स्पर्ट आते हैं तो बच्चे उस समय जल्दी जल्दी फीडिंग मांगते हैं, मदर को ऐसा लगता है कि उसका दूध कम है, इस वजह से उसको ऐसा लगता है कि बच्चा फीडिंग नहीं करना चाहता, तो या उसके लिए दूध पूरा नहीं हो रहा है। तो इसलिए आपको ये सब चीजों का ध्यान रखना है कि कोई टेंशन नहीं लेनी है, आप आराम से बच्चे को अपना फीडिंग कराइए, बस डिस्ट्रैक्शन हटाइए। क्योंकि आपने जैसा मेंशन किया है कि बच्चा सोता हुआ दूध अच्छे से पी रहा है, तो इसका मतलब दूध की कमी नहीं है, बच्चे को दूध भी पीना आता है, बस बच्चा दिन में डिस्ट्रैक्टेड रहता है जिसकी वजह से वो फीडिंग प्रॉपर्ली नहीं करता। नेक्स्ट क्वेश्चन है कार्तिका का। कार्तिका कह रही है, कार्तिका इज आस्किंग हाउ टू इंक्रीज मिल्क सप्लाई एंड वीन ऑफ फॉर्मूला। So how to increase milk supply? In all my Ask Me Anything sessions, I always advise mothers on like how to increase breast milk supply. So for increasing breast milk supply, the the important things are, first of all, your hydration. You should have good hydration so that your breast milk secretion is well. Just give me 1 minute. Okay, so I have also opened Instagram live right now. So I am also active on Instagram right now. So I'm taking questions from there also. So first of all, I'll answer this question from Kartika, whose question I was answering about how to increase milk supply and wean off the formula. So how to increase milk supply, I was talking about, first of all, hydration, a good hydration. So having 3 liters of water is very good, which will improve the milk supply in a way that it will improve the hydration. Second part is by your demand and supply protocols. So because first of all, you have to see how many times your baby is demanding milk. So if the baby is demanding, suppose 8 times of milk, then obviously if you are expressing the milk or feeding the baby only 3 to 4 times, the demand is less. So you have to always increase the demand so that your brain understands the demand and starts making milk supply accordingly. Third thing is about your massage in the compress, which will improve the flow of the milk. And fourth thing is lot of skin to skin, which will improve the mother and child bonding, and the baby will improve, will start coming on the breast. That way it will help a lot. So all these things are very important in how you will know whether the things are working well for you or not. That is by checking the baby's weight. So if your baby is less than 3 months of age, the baby should gain 200 grams per week. So in this way, you will be knowing if you are going well. If the baby's weight is increasing more than 200 grams per week, then you have to decrease the formula. Next question is from Pooja. Can I start breastfeeding to 3 months old baby? Yes, definitely, Pooja, you can start breastfeeding to your 3 months old baby. So 3 months, what happens? It is usually the growth spurt. So during growth spurts, the baby's demand increases and baby tries to feed more. And the mother feels that her milk supply is less and she gets underconfident and she starts giving formula milk or any kind of milk, or she feels that, okay, I don't have enough milk. So Pooja, first of all, it is definitely a yes that if you want, you can definitely start breastfeeding to your 3-month-old baby. And if your breast milk supply is very less, then obviously we need to first work on improving the milk supply. Next question is from Himangi. How to increase breast milk production? So I just answered this question for Kartika, that how to increase the breast milk production. So this way, Himangi, those are the tips which you can work on improving the milk supply. Next question is from Jyoti. Can we feed baby 3 hours or it's affect the milk production rather than 2 hours? So first of all, Jyoti, see, always understand it is never like that it should be a clogged feeding, because we as adults don't eat like at regular intervals. Like you can't clock yourself that I should eat every 2 hourly or every 3 hourly. Then if you are not eating 2 hourly or 3 hourly yourself, how can you clock your child for that the baby should feed 2 hourly or the baby should feed 3 hourly? So that's why, first of all, you have to always look at your baby's demand. Now, what are the baby's cues, or what we call as hunger cues? So you have to understand the baby's hunger cues. So baby's hunger cues are like the baby, whenever you touch something around the cheek of the baby will move the head towards the finger. So this way you will understand this is called as rooting reflex. So these are very important to understand that your baby demands milk, baby is asking, wanting milk, and you can put the baby on the breast. So I will always say that you should always feed on demand rather than the clocked feeding. And yes, I would also say that some mothers might feel, because babies, when they are small, like at say less than 6 weeks, their sleep cycles are long. They sleep for 13-14 hours also. So in that case, how to know whether they are hungry or they are sleeping? So that time, what I say to mothers, if the baby is less than 6 weeks, the maximum gap which you can keep is up to 3 hours. If your baby is sleeping more than 3 hours, then definitely you have to wake up the baby. But once your baby crosses 3 months, then I would suggest you on demand feeding more rather than the clocked feeding. Next question is from Manasa, who says low milk supply. So Manasa, I've already answered this question just now, how to increase milk supply. So you can increase your milk supply by following the tips which I just suggested. And I always suggest some galactogogues like Lactomagic powder and Moringa tablets. I have heard many mothers using a lot of market make products. So one thing you have to always be very specific, that the galactogogues which you are using for improving the milk supply, please always check that they don't have any preservatives added into that. If you are just seeing the container, you can see if there is any preservative added into that. So preservatives are not good for mother's health. So if you have to see if the preservatives are added into that, then I recommend not using them, because preservatives are chemicals which are added to food products to increase their shelf life. And the preservatives are usually sodium paraben, where parabens are not good for even local application. So internally, it is not advised you to take any kind of chemicals. So always just see any kind of mixes if you are taking for yourself to improve the milk supply, they should not have any preservatives added into that. Next question is from Arpita. Arpita says, want to breastfeed exclusively, but not producing enough milk for 20 days old baby. Arpita, your baby is just 20 days old baby. So girl, please relax. You will definitely improve the milk supply. Not producing enough milk for 20 days baby, that I am very sure the demand supply chain is getting disturbed. So first of all, you have to work on improving your demand supply chain, and the tips which I just suggested to increase the milk supply, they will definitely improve your milk supply. Next question is from Mrs. Sangeeta. बेबी को बॉटल फीड के बाद दोबारा ब्रेस्ट पे कैसे लाएं? वेरी गुड क्वेश्चन. सो संगीता, होता क्या है कि हमारे बच्चे को अगर हमने पूरा उसका जितना डिमांड है, सपोज उसका 60 ml का डिमांड है, उसका 90 ml का डिमांड है, और बच्चा अगर पूरा दूध पी लेता है तो दोबारा उसको ब्रेस्ट पे लाना बहुत मुश्किल हो जाता है। तो वहां पर काम करता है मिड बॉटल फीडिंग। तो उसमें हम क्या करते हैं, बच्चे को पहले, सपोज बच्चे का 60 ml पीता पिलाते हो आप उसको, तो आप पहले जब वो 30 ml दूध पी ले तो बॉटल हटा करके आप उसको ब्रेस्ट पे वापस ले लो। इस तरह से आप बच्चे को अगर बीच बीच पे फीडिंग कराओगे बॉटल के, तो बच्चा ब्रेस्ट पे आने लगेगा, और ये जब डिमांड बढ़ेगी तो आपकी मिल्क सप्लाई भी डेफिनेटली इंक्रीज होगी। इस तरह से आप अपनी मिल्क सप्लाई को बढ़ा सकते हो। लाइव में जो भी क्वेश्चंस आ रहे हैं, आई जस्ट टेक देम आफ्टर आई आंसर द क्वेश्चंस व्हिच आर ऑलरेडी विद मी। आई विल टेक द क्वेश्चंस वंस आई आंसर द क्वेश्चंस which are already filled by mothers with me. So next question is from Alankriti. Alankriti says milk supply related issue. तो अलंकृति, मुझे आपका क्वेश्चन नहीं पता, आपने सिर्फ यू हैव जस्ट रिटन मिल्क सप्लाई रिलेटेड इश्यू. आई डोंट नो व्हाट इज योर क्वेश्चन स्पेसिफिकली, सो इफ यू कैन राइट द क्वेश्चन, व्हाट इज योर स्पेसिफिक क्वेश्चन व्हिच आई कैन आंसर यू. Next question is from Shivani. My baby is 6 months old and she is not latching and not to directly breastfeeding. So now chances are possible to she is directly breastfeed. So Shivani, it will always depend that if the milk supply, how is the milk supply? Because a 6 months old baby is a smart, like obviously is a grown up baby. So the baby understands the flow, and if the baby is hungry and the baby is not getting milk on the breast, then definitely the baby will not cooperate. So if your milk supply is good, then definitely you can try of getting the baby on the breast by the mid bottle feeding, which I always suggest. And if possible, you can replace the bottle. That will work a lot, but I understand removing a bottle at 6 months age will be a big task. So you can do the mid bottle feeding, which I always suggest to mothers. Next question is from Soumya. After baby takes complete areola into mouth, still wipe nipples pain. Soumya, it is because you don't have to give complete areola into baby's mouth. You have to give only the lower part of areola in the baby's mouth. If you try to give full areola in the baby's mouth, the baby will feel stuffed. Sometimes the baby will start to bite you, and that time you might have nipple pain. That's why try to give only the lower part of the areola in the baby's mouth, while the upper part of the areola should be visible. Next question is from Shruti. How to increase breast milk? So Shruti, I've already answered this question, how to increase breast milk. You can go through this live again, and the recording of this live, you can definitely watch the answer before. Next question is from Himashri. Ma'am, my baby is month old and she is not latching. I got lumps in breast and supply is almost like 100 ml per day. I extract and give. So Himashri, lumps will always come in the breast if you have good milk supply. So if you are having lumps, that means you have milk in the breast, but lumps will cause obstruction in the vessels. So what you have to do regularly massage in the compress, which will improve the flow of the milk, and the lumps will dissolve and the milk flow will improve. So what you will say, your baby is just 1 month old. So 1 month old baby can be brought easily on the breast. So just follow the proper latching techniques, which I have advised. Follow them properly so that your baby can come on the breast and latch properly. For 1 month old baby, Himashri, it is very much possible. You can definitely breastfeed your baby. So please don't lose any hope and keep trying. Follow the cross cradle hold techniques, which I always recommend you all. Just follow that. Your baby will definitely come on the breast, and you are getting lumps in the breast. So please do oil massage and the warm compress, and it will improve the milk supply. Next question, milk flow. Next question is from Yesha. My baby is not latching and my milk supply is low. So Yesha, now see, you have already answered your question. Your baby is not latching and your milk supply is low. So if the milk supply is low, the baby will not latch. And when the baby will not latch, milk supply will go low because there is demand and supply protocol disturbed. So what you need to do regularly, that you have to, for improving your milk supply, you have to follow the tips which I have just answered, and try to put the baby on demand and supply protocol. And once the baby gets habitual to improving, like coming on the breast, even for few seconds, it is very important that your baby can come on the breast even for few minutes also. I am always encouraging the mothers, because if your baby is coming on the breast even for few times, it is also important that you should keep trying. Now, suppose you have tried only for 3 times and baby has come on the breast only 1 time, you feel demotivated. But if the baby is taking feeds 8 times and you are trying every time 8 times, then the chances of baby coming on the breast will increase. So that way you will feel more confident and you will definitely be able to breastfeed your child. Next question is from Mercy. Should we continue the lactating medicine when the baby is latching? So now depend, Mercy, what is the weight of your baby? What is the weight gain? If you are not giving formula milk and your baby's weight is increasing, then definitely you can start reducing the medicines which you are taking for improving the milk supply. Next question is from Jayanti. How to increase milk supply? So Jayanti, I have already answered this question just now before this. Next question is from Trupti. Low milk supply. So Trupti, I have also already answered. Let me see other questions. Next question, I'm just moving this here. Yeah. So next question is from Monica. Low milk supply. Next question is from Monica. Low milk supply. I've just answered this question, Monica. Next question is from Divya. How to treat cracked nipples? Very good question, Divya. So cracked nipples. First of all, let's understand why the nipples get cracked during breastfeeding. Basically, it is because of the shallow latch. So why does the shallow latch? If the baby is doing nipple feeding, it is called as a shallow latch. And obviously, because of the shallow latch, the baby will bite on the breast and you will have cracked nipples, and sometimes they become so severe that you even start bleeding with that. So how to treat the cracked nipples? First of all, you have to improve your latching. And how to improve the latching? See, always, now all of you do one thing with me. Everybody touch your tongue on the upper palate. Everybody do that. Now, when you are touching your tongue on the upper palate, at the back side, you will see a dome kind of a thing. So nature has planned everything so well. The dome, why is the dome? You have your nipple, mother's nipple should go to till the dome. And when the nipple is safe and secure there, the milk supply, obviously the milk will flow better. And you can see, you can just put the tongue just behind your teeth. So you will see you will feel it is very hard. And that is the hard palate. And that has to be on the areola. So if this hard part is on the areola and it is sucked properly, the milk flow will be better and the milk transfer will be better, and the mother will not feel any pain and she will have no cracks. So this way you can improve your latching techniques by following a proper latching method, and cross cradle hold is a very good method for having a good latch. Next question is from Anju. Anju says, how to latch with large breast and alveolar area? So Anju, if the areola is large, or if you have heavy breast, then you can follow the cross cradle hold, and you don't have to give full areola in the baby's mouth. You have to give only the lower part of areola. The full areola will be too big for the baby. So that's why you have to only latch the baby from the lower part of areola. Now, how about the large breast? So for the large breast, if your baby is more than 3 months of age, you can follow the cradle hold, or even this football hold works very well. So that way you can try. Second thing is, if your baby is less than 3 months, the cross cradle hold works very well for mothers with large breast and areola. Next question is from Shift. Baby is 13 weeks, 3.25 kgs, gained 50 grams in 1 week. I have reduced top feeds from 10 to 5 per day and increased breastfeeding. Is it okay? 50 grams in 1 week is very less. Your baby is 13 weeks old. So baby is like 3 months plus. So you have to at least focus 150 grams in a week. So 100 grams is less right now. What I would suggest, just follow for this 1 week again. If the baby's weight still not increases, then obviously you have to work on improving your milk supply. Next question is from Cypria. How to increase breast milk supply? So Cypria, I have just answered that question. You can go through the recording and you will see the answer to that. Next question is from Lavina. My baby has weaned off, but I want to continue feeding. So Lavina, that is a good thing. If you want to continue feeding, you can obviously, when your baby has baby sleeping, little sleepy, that time you can bring the baby on the breast, and this way your baby will definitely start to breastfeed again. Next question is from Archana. मैं आपकी कंसल्टेशन ले चुकी हूँ, बट मैं ससुराल जाने वाली हूँ, कांट वेट, कोई और तरीका है जिससे फॉर्मूला देना है या नहीं डिसाइड हो? सो अर्चना, आपको कैसे पता चलेगा कि आपको फॉर्मूला देना है कि नहीं? आप बच्चे का वेट चेक करेंगे. अगर आपका बच्चा 3 मंथ से छोटा है तो बच्चे का 200 ग्राम पर वीक वजन बढ़ना चाहिए। अगर बच्चा 3 महीने से बड़ा है तो बच्चे का वेट 150 से 150 ग्राम के लगभग होना चाहिए। तो इस तरह से आपको पता चलेगा कि आपको बच्चे को फॉर्मूला देना है कि नहीं। नेक्स्ट क्वेश्चन इज फ्रॉम मनसा। माई सप्लाई इज गोइंग लो, बेबी इज 9 months old, hardly 80 to 100 ml per day. Please suggest tips. So Manasa, if your milk supply is less and you are a 9-month-old baby's mother, you can definitely improve the milk supply by following the tips which I just answered about how to increase milk supply. Just a minute. Okay. So next question is from Saida Samreen. After trying for breast milk supply to increase and following the protocol, in how many days the milk supply increases usually? So Saida, first of all, if you follow the protocols which we suggest you full on point, then definitely in 1 week itself, you will start seeing the improvement in milk supply. And then I need to check it after 1 week, what is the improvement? And accordingly, I have to change the protocols and change the other things, and so that the milk supply can further improve. Next question is from Anisha. Low milk supply from birth to 6 months. So Anisha, you can definitely improve the milk supply. Just follow the tips which I just gave for improving the milk supply. Your milk supply will definitely increase. So this was all about the questions which you all mothers have sent. Now I'll take the questions from the Q&A box and also which the questions which have come to me on live. So let me first start with these questions. So where are the questions? I couldn't see the questions from the YouTube. So all the YouTube viewers, please write your question again so that I can see the questions. I am not able to see the questions. जो लोग YouTube पे लाइव हैं, प्लीज अपने क्वेश्चंस इस पे डाल दीजिए जिससे मैं आपके क्वेश्चंस को फिर से देख करके आंसर कर सकूं. So let me first start the Instagram questions. Oh, there are so many questions. Just a minute, girls. Let me see the questions. मैम मेरे निपल की साइज बड़ी है तो लैच नहीं कर सकता. क्यों नहीं कर सकता? आपका बेबी डेफिनेटली लैच कर सकता है. आप बेबी को लैच कराते समय मिल्क सप्लाई पे अच्छे से फोकस करिए और बेबी का माउथ को ओपनिंग कराने का एक टेक्निक होती है, उसको फॉलो करिए. उसके लिए आप क्या करोगे, बच्चे को जब आप ब्रेस्ट पे लाते हो तो आप ब्रेस्ट को लेफ्ट साइड अपोजिट हैंड से होल्ड करोगे और बच्चे के अपर लिप पे पहले टच कराओगे. बच्चे का जब अपर लिप पे टच कराओगे तो बच्चा थोड़ा सा मुंह खोलेगा, ऐसे करेगा. अगर बड़ा मुंह नहीं खुला है तो बच्चे को थोड़ा पीछे ले जाकर के फिर से ट्राई कराओगे, ऐसे 1-2 बार आगे पीछे करके, जैसे बच्चे को चिढ़ा रहे हो लेकिन मुंह में नहीं दे रहे हो. तो बच्चा इरिटेट होकर बड़ा सा मुंह खोलेगा, ऐसे करके करेगा. जब बच्चा बड़ा सा मुंह खोले उसको अंदर ले लो. इस तरह से इवन अगर आपका निपल साइज बड़ा भी है तो भी आप बच्चे को डेफिनेटली ब्रेस्ट फीड करा सकते हो. The same questions are repeating, so I am not taking the ones which I have already answered because I can see so many questions. So I'll only answer the ones which are new. So next question is from Subbu. Which is the best time to pump milk? Is it necessary to pump every day after every feed? Now it will depend if you are trying to improve the milk supply. So if you are trying to improve the milk supply, then obviously to improve the demand, you can pump after your feeding session is done. Also, there is an indication of knowing whether to pump or not. Once your baby has breastfed, you just check the color of the milk. If the color of the milk is thick white, that means that is the hind milk, and obviously definitely you have to express that milk. If the milk's color is translucent, that means that is the this fore milk, and the breast milk has first fore milk comes in, then hind milk comes in, and definitely milk supply is never zero in the breast, so it will even come the next session milk. So if you are seeing the fore milk, the translucent milk, that means that breast is empty. So that time if you have to increase the milk supply, then you can just like hand express the breast so that there is an extra demand for your brain to understand and improve the milk supply accordingly. Next question is from, does gassy food eaten by moms harm babies? So first of all, girls, never doubt yourself, please. Relax. Your eating is not going to have any kind of problems if you are a breastfeeding mother. Okay, please stop taking stress should I eat this, should I eat that, should I eat this? See, always remember, you have to be like feeding your baby happily, not with a stress. Breastfeeding is not a punishment to you. It is not like that if you are feeding your baby, you can't do this, you can't do that. Because if you are doing that way, it is always like your mind is always occupied. Whether did I do this wrong? And sometimes if your baby is having colic, you will start doubting yourself. Whether did I eat that? Did I eat that? So I don't want you all to be so stressed out. Breastfeeding is a beautiful experience. Please have your breastfeed your baby without any stress. So all these things are myths. Anything eaten, anything that. So please, no restrictions from my side. You can have your food, enjoy your food, and happily breastfeed your baby. Next question is from Mayuka Trotia. मैम ब्रेस्टफीडिंग 2 आवर्स लगते हैं, इतना टाइम क्यों लगता है? गुड क्वेश्चन. सो क्यों इतना टाइम लगता है? बच्चे 2-2 घंटे तक फीड करते हैं. क्योंकि वो 2 घंटे तक फीड नहीं करते हैं, वो बीच में सो जाते हैं. इसको बोलते हैं एक्टिव फीडिंग और पैसिव फीडिंग. तो एक्टिव फीडिंग और पैसिव फीडिंग को पहले हमें समझना होगा ये क्या होता है. आपने कभी पानी पीते समय अपने गले को देखा है? वहां पे गल्पिंग मूवमेंट होता है, जिससे हम कोई भी चीज पीते हैं तो गल्पिंग का मूवमेंट हमें फील होता है, हमें दिखता है. अब आप लोग अगर कैसे पता लगाओगे कि आपका बच्चा दूध पी रहा है या सो रहा है? उसके लिए आपको क्या करना है, अपने बच्चे को ब्रेस्ट फीड कराते समय उसके नेक को देखोगे. अगर आपको गल्पिंग मूवमेंट दिख रहा है, इसका मतलब आपका बच्चा एक्टिव फीडिंग कर रहा है. लेकिन अगर आपको नेक का मूवमेंट नहीं दिख रहा है, इसका मतलब आपका बच्चा सो रहा है, वो पैसिव फीडिंग है. आपने कभी ध्यान दिया हो कि आपका बच्चा सोते समय भी मुंह चलाता रहता है? तो इसलिए आपको पैसिव फीडिंग नहीं करानी है, आप सिर्फ और सिर्फ एक्टिव फीडिंग कराओगे. तो अगर आपको 2 घंटे लगते हैं तो आप ध्यान दो, आपका बच्चा पैसिव फीडिंग कर रहा होगा. ठीक है. नेक्स्ट क्वेश्चन फिर से उसने बोला कि 1 आवर में तो फिर से कराना पड़ता है, ऐसा क्यों? तो मैंने अभी मयूरी आपको आंसर बताया इस बात का कि आपका बच्चा अगर पैसिव फीडिंग करेगा तो क्योंकि वो तो सो रहा था, आपको लग रहा है कि वो 2 घंटे तक फीड कर रहा था क्योंकि वो तो सो रहा था. तो जब वो 2 घंटे बाद जब वो फिर से, क्योंकि आपने जैसे उसको ब्रेस्ट से हटाया, उसका पेट तो भरा नहीं था क्योंकि उसने दूध पिया ही नहीं था ना, वो तो पैसिव फीडिंग कर रहा था. तो उस केस में क्या होगा, बच्चा भूखा रहेगा, फिर 1 घंटे बाद दूध मांगेगा. तो आपको पहली चीज तो एक्टिव फीडिंग करानी है, और दूसरी चीज जो मैंने अभी आपको बताया कॉन्सेप्ट हाइंड मिल्क और फोर मिल्क का, वो आप ध्यान दोगे. नेक्स्ट क्वेश्चन है, ओके, सो ऑल दीज आर डन. सो इसके लाइव हो गए. अब मैं नेक्स्ट लाइव क्वेश्चंस लेना शुरू करती हूँ. ओके. नेक्स्ट क्वेश्चन इज फ्रॉम मिसेस अकरम. मेरा बेबी 3.5 months का है, वो स्टार्ट से ब्रेस्ट फीड नहीं कर पाती थी, तो बॉटल से ब्रेस्ट मिल्क देना स्टार्ट कर दिया था. मैंने ना पंपिंग बहुत मुश्किल है, अब मैं चाहती हूँ कि वो ब्रेस्ट से नेचुरल तरीके से आ जाए, तो क्या करें? देखिए मिसेस अकरम, आपका बेबी 3.5 महीने का है. 3.5 महीने के बच्चे को अगर आप अभी तक बॉटल फीड कराते हो तो उसको बॉटल की बहुत आदत लगी हुई है. तो आप क्या करोगे, अगर आप बच्चे का बॉटल का फीड का आदत है और अगर आप उसको ब्रेस्ट फीड पे लाना चाहते हो और मिल्क सप्लाई अगर आपका बहुत अच्छा है, तो आपको सिर्फ एक काम करते जाना है. बच्चे को आप आधी बॉटल पिलाने के बाद उसको ब्रेस्ट पे एक बार लेकर के आओ. बच्चा उसके बाद भी अगर रोता है तो उसको बॉटल दे दो, बट आप हर बार बच्चे को बीच बीच में ब्रेस्ट फीड कराओ. इससे क्या होगा, जब आप बच्चे को रेगुलरली बीच बीच में ब्रेस्ट फीड कराओगे तो बच्चे की थोड़ी थोड़ी आदत पड़ेगी और बच्चा अच्छे से ब्रेस्ट फीड करना शुरू करेगा. और अगर बच्चा इवन कुछ सेकेंड्स के लिए, कुछ मिनट्स के लिए भी आता है ना, तो उसे घबराओ मत, उसे डिसहार्टेंड मत हो. बच्चे को रेगुलरली जब आप ब्रेस्ट फीड कराओगे तो बच्चा डेफिनेटली धीरे धीरे ब्रेस्ट पे आने लग जाएगा. लेकिन हमेशा याद रखो कि बच्चा कुछ सेकेंड्स आया तो आपको लगने लगता है इससे क्या फायदा हुआ. आपको अगर बच्चे को आप रेगुलरली ट्राई कराओगे तो बच्चा डेफिनेटली आपका ब्रेस्ट फीड करने लगेगा. Next question is from an anonymous attendee. How many days can we store breast milk in freezer? Good question. So the storage guidelines of breast milk is 3 to 4 hours at room temperature, 3 to 4 days at a normal refrigerator. And if you're keeping in your freezer and your electricity output is fine, you get regular electricity, or your freezer is not getting opened regularly, you can keep it for 4 to 6 months also. And but if you have electricity issues and your freezer is opening regularly, then you can keep it for 2 to 3 months. Next question is from Reema Dimar. I have 2 months old baby. My problem is low milk supply. आपके एक वीडियो में आपने कहा था कि नाइट के टाइम पे फॉर्मूला नहीं देना चाहिए. नाइट में जब मैं जब बेबी को ब्रेस्ट फीडिंग कराती हूँ तो थोड़ी देर फीड करने के बाद बेबी सो जाता है, फिर गोदी से नीचे रखते ही रोने लगता है, फिर वो ब्रेस्ट फीड नहीं करती है, फॉर्मूला देना पड़ता है. ठीक है रीमा, तो इसके लिए आप एक काम करोगे, आप बच्चे को साइड लाइन होल्ड में फीडिंग कराओ. आप बच्चे के साइड में लेट जाओ, जब बच्चा आपका उठता है तो आप उसको उठाओ मत, क्योंकि क्या होता है बच्चे का पेट भर जाता है, लेकिन हम बच्चे को जैसे ही लेटाते हैं बच्चे डिस्टर्ब हो जाते हैं और फिर वो रोने लगते हैं. तो इस केस में आप क्या करोगे, बच्चे को ब्रेस्ट फीड कराओगे आप साइड लाइन पोजीशन में. आपका बच्चा जब दूध पी करके सो जाएगा तब आप नॉर्मल बच्चे को छोड़ दो, बच्चा थोड़ी देर बाद खुद ही ब्रेस्ट को छोड़ के अच्छे से सो जाएगा. Next question is from Alankiti Asthana. My baby does not delatch by herself. She can goes on for more than 1 hour breastfeeding. She is of 6 weeks and her weight is also not gaining. Born with 2.76 kgs and current weight is 2.86 kgs. And how to know that baby is getting adequate amount of milk? But when I burp her, she does burp. Okay, good, Alankriti, because you are a 6 weeks old mother, I can definitely understand that you have a lot of questions. So when you say 6 weeks and the weight is not gaining, so girls, first of all, understand what are the growth spurts. Growth spurts come at 2 weeks, 6 weeks, 3 months, 5 months, and 7 months. So as your baby is 6 weeks old right now, the baby is on like right now going through a growth spurt. During growth spurt, the baby will demand milk like again and again. So that's why she's feeding again and again. And 1 hour of breastfeeding, I just told you the concept of active feeding and passive feeding. So if you are seeing that she's not delatching herself and keeping for 1 hour of breastfeeding, then you have to see if the baby is doing passive feeding and remove the baby from the breast if the baby is doing a passive feeding. Now, if you said that the baby is not gaining weight, that means either her latch is not deep, she's not able to empty the breast, like the hind milk she's not able to drink, or it is because of the growth spurt, because her growth spurt is going on. And during the growth spurt, usually babies don't gain weight. It is basically for 1 week. So just keep okay and just keep observing the pattern. After 1 week, you start like feeding again. If she starts gaining milk, gaining weight, then it is definitely fine. Now, because you said the baby was born 2.76 weight and current weight is only 2.86 kgs, this is definitely not done. So Alankriti, it is just 100 grams weight for a 6 weeks baby from birth weight. This is definitely not good. You have to work on improving the milk supply, or you have to see that the baby is emptying the breast. You can check it after like breastfeeding. You just press the color of the milk and see if the baby is like, if you're seeing hind milk, the thick white milk, your baby is not emptying the breast. So once your baby breastfeeds, you just hand express or pump for a few minutes. And once the baby starts gaining weight, then definitely fine. And about burping, see, if the baby is burping, that doesn't mean that you have adequate amount of milk, or it doesn't, burping has no relationship with adequate milk supply. It is only the weight gain. So you have to see the baby's weight should increase. Next question is from Reema Dhimar. ब्रेस्ट मिल्क एंड फॉर्मूला मिल्क दोनों देने से कोई साइड इफेक्ट्स हो सकते हैं क्या? नहीं, कोई साइड इफेक्ट्स ऐसा नहीं है, ऐसा कुछ नहीं. Kartika S. Hi ma'am, I am Kartika. My baby is 2 months old. I am mixed feeding my baby 8 to 10 times breastfeeding and 4 times formula milk feeding. She is feeling gassiness and fussy in the evening and only taking formula milk in the evening and rejecting breast. Any advice for colic and weaning of formula? So for colic, first of all, you can just see that it is basically right now the baby is taking formula milk around 4 times. No? Yeah, 4 times of formula she's taking, maybe because she's not getting used to the formula. So if your baby is already breastfeeding, you can definitely improve the milk supply. Your baby is 2 months only, you can definitely improve the milk supply. And once the baby starts getting more and more of breast milk, the baby's colic will go away. Second thing is taking only formula milk in the evening. You have to just check if your milk supply is going low during the evenings. Basically, during evenings, babies are doing cluster feeding. So you might be feeling that your milk supply is less. So Asma, tips for bottle feed baby to take on breast. I'll come on that, Asma. अभी बताते हो आप. So Kartika, I was continuing with the thing that evening is cluster feeding times. So because of the cluster feeding, it feels like that your baby is demanding more and you don't have enough milk. I can definitely understand that, but don't worry at all. It is basically not the low milk supply. In the evenings, basically babies do cluster feeding, and I am very sure if your most of the formula would be given in the evenings. So if you are seeing that your formula milk intake is more in the evenings, it is because of the this cluster feeding. Just check the baby's weight. If your baby is gaining 200 grams per week, then definitely you can start decreasing the formula slowly and you can get the baby on exclusive breastfeeding. Next question is from Anne Mary. How can we wake up baby during feeding? So if you are seeing your baby is sleeping during the feeding sessions, and you can just rub around the ears, and you can like tickle them on the foot, and also you can like just like doing around the ears will be fine, or tickling, and this way you can get your baby. You can just like wake up your baby. So Asma पूछ रही है tips for bottle feed baby to take in breast. So Asma, I have just answered this question that if you are trying to breastfeed your baby, you can get the baby from the bottle feed. You want to get the baby on the breast, then you can first start feeding your baby in the mid bottle feeding. So first feed your baby on directly breast, then give little half amount of the bottle feed, and then take the baby back to the breast. So this way, mid bottle feeding, if you try every feeding session, the baby will start coming on the breast for a few seconds, and then just keep working on it. The baby will start like come on the come on the milk on the breast directly. But you have to make sure your milk supply is good, your milk flow is good, and your latching technique is good. All these three things should be all well and in a proper way. Next question is from Alankriti Asthana again. Also, my doctor says that when I breastfeed the baby on right breast, then drops should come from the left breast and vice versa. But this does not happen with me. No, Alankriti, this is just a myth. Please don't believe on that. Basically, leaking from the other breast is an oxytocin reflex, which is not compulsory for every mother to feed. So it will be there for some mothers for first 6 weeks. After that, it is not compulsory for every mother to have leaking from the other breast while you are feeding the baby from one breast. So please don't get confused by this. Your milk supply is definitely good if your baby is gaining 200 grams per week. So relax, Alankriti, about it. Next question is from Archana Kumari. What is the uses of moringa tablets for increasing breast milk supply? Moringa is a herb which improves the quality of milk. So if your baby is not gaining good weight with breastfeeding, and then moringa improves the milk supply, the constituents of milk, it makes the milk more dense, and it definitely helps in improving the milk supply and milk quality. Next question is from Mercy Lobo. I am using the medicines which you have team has suggested. During this time, can I make the child to drink my milk? Yes, definitely, Mercy. You can feed your baby while the medicines are suggested. Asma, my baby is 1.5 months old. He starts crying whenever I take him on breast. So I hand express the milk and give him in bottle. I give both top milk and bottle milk in milk. Yes, Asma, that's fine if your baby is taking milk, express milk, but follow the tips which I just told you about on giving the mid bottle feeding. And then when you try for that, your baby will slowly start coming on the breast. And once the baby starts coming on the breast, just try to scale it up. It will improve your milk supply and your baby will also start coming on the breast regularly. Next question is from Anne Mary. My baby's stool are green always. I can see only for milk on breast always. So basically, green stools are due to two reasons. First of all, if the baby is having formula milk, the stools are usually green. And if the baby is on exclusive breastfeeding and the baby is passing green stools, then it is due to the imbalance of fore milk and hind milk. Next question is from Mrs. Akram. मैम प्लीज मुझे बता दें, मेरा बेबी 3.5 महीने का है, मैं मिड बॉटल फीड करा के भी थक क्या देख लिया, वो तब भी डायरेक्ट ब्रेस्ट पर नहीं आ रहा है, स्टार्ट से पंप करके दे रही हूँ मैं, मुझे कोई सोल्यूशन बता दे कि बेबी नेचुरल तरीके से आ जाए। सो अकरम, मिसेस अकरम, आपको ये चीज का ध्यान रखना है कि आपका बेबी जब जिस समय थोड़ा नींद में होता है उसको आप ड्रीम फीडिंग करा सकते हो। बच्चे को नींद के टाइम पे समझ में नहीं आता है कि वो बॉटल है कि ब्रेस्ट है। अगर आपका मिल्क सप्लाई बहुत अच्छा है तो आप बच्चे को नींद के टाइम पे थोड़ा थोड़ा ब्रेस्ट पे लाना शुरू करिए। और मिड बॉटल फीडिंग आपने कितनी बार ट्राई कराया मुझे नहीं पता, 3.5 महीने के बच्चे को आप हर बार ट्राई करोगे तो आएगा। आपको इतना जल्दी पेशेंस लूज नहीं करना है। बच्चा अगर ब्रेस्ट फीडिंग बॉटल फीडिंग बचपन से कर रहा है, बर्थ से कर रहा है, तो ऑब्वियसली उसमें आपको थोड़ा पेशेंस लगेगा। इस पे आपको रेगुलरली काम करना पड़ेगा अगर आप बच्चे को डायरेक्टली ब्रेस्ट फीड पे लाना चाहते हो तो। Next question is from Alankriti. Can we breastfeed her while lying down? Yes, Alankriti, you can breastfeed your baby or by lying down. Next question is from anonymous attendee. बेबी को बॉटल से ब्रेस्ट पे शिफ्ट करना मन क्या में कितना दिन लगते हैं? बेबी एज 4 months है, स्टार्ट से बॉटल फीड पे है। तो आप ये चीज अभी कैसे सोच सकते हैं? आपका बच्चा 4 महीने का है कि वो कब ब्रेस्ट से बॉटल पे आएगा? हर बच्चा डिफरेंट है, हर मदर की मिल्क सप्लाई डिफरेंट है, हर फैमिली फर्क है, हर माँ फर्क है। तो एक जैसे रूल्स रेगुलेशंस लागू नहीं होते। आपको आपके बच्चे के हिसाब से काम करना है। आपके बच्चे को माँ का दूध मिल रहा है, सबसे पहले तो आपको इस बात को अपने आप को खुश रखना है कि चलो माँ का दूध बच्चे को मिल रहा है, चलो बॉटल से मिल रहा है, ठीक है कोई बात नहीं, बच्चे को माँ का दूध तो मिल रहा है। अब दूसरी चीज ये है कि अगर आपको बच्चे को ब्रेस्ट पे लाना है तो आपको अपने बच्चे को देखना होगा, आपको अपने बच्चे को रेगुलरली ट्राई कराना होगा। बच्चा अगर 4 महीने से बॉटल पे है तो क्या एक दिन में नहीं आएगा? 4 महीने से वो बॉटल पी रहा है, उसको बॉटल की आदत है, उसको बॉटल समझ में आती है। तो कुछ चीजों का आप ध्यान रख सकते हो, मैंने अभी कुछ चीजें आपको बताई भी हैं। दूसरी चीज, बॉटल को आपको ऐसी बॉटल यूज करनी है जिसमें बॉटल को आप जब घुमाओ तो नीचे दूध अपने आप ना गिरे। तो आपको ऐसी बॉटल लेनी है जिसमें बच्चे को सकिंग करनी पड़े। तो अगर ऐसी बॉटल से बच्चा दूध पीता है जिसमें बच्चे को मेहनत करनी पड़ती, खींचना पड़ता है, तो वहां पे वो ब्रेस्ट पे आने में फिर भी इंटरेस्टेड होगा अगर आपकी मिल्क सप्लाई अच्छी है। दूसरी चीज, आप बच्चे को जब ब्रेस्ट पे ला रहे हो तो आपको ये ध्यान रखना है कि थोड़ा मिल्क आप ब्रेस्ट पे थोड़ा प्रेस मसाज करके, ब्रेस्ट को थोड़ा हैंड प्रेस करके थोड़ा सा मिल्क निपल में थोड़ा मतलब फ्लो बना लो। उसके बाद आप बच्चे को ब्रेस्ट पे लाओ। क्योंकि क्या होगा, अगर बच्चा ब्रेस्ट पे आया, अब इसको आदत नहीं है, हमारे ब्रेस्ट से मिल्क कब कब सिक्रीट होना शुरू होता है? जब बच्चा सकिल करता है, ब्रेन को सिग्नल जाता है, ब्रेन लेट डाउन धीरे धीरे मिल्क को रिलीज करना शुरू करता है। तो जो बच्चा शुरू से ही ब्रेस्ट फीड पे है वो इस चीज को समझता है। लेकिन जिस बच्चे को बॉटल की आदत है, बॉटल में दूध उसको फौरन मिल जाता है, इसलिए बच्चा को पेशेंस नहीं रख पाता, रोने लग जाता है। तो आपको क्या रखना है कि थोड़ा ब्रेस्ट को हैंड प्रेस करके थोड़ा सा मिल्क का फ्लो बना लो। दूसरी चीज, आपको ये ध्यान रखना है कि बच्चा आपका बहुत भूखा नहीं होना चाहिए। आपका बच्चा, अगर आप बच्चे को थोड़ा फ्रीक्वेंटली फीड कराओगे तो बच्चा ब्रेस्ट पे बेटर कोऑपरेट करेगा। और अगर बच्चा बहुत भूखा हो ही गया तो आप बॉटल के बीच में फीडिंग कराओ। आप इन टिप्स को रेगुलरली फॉलो करोगे, देखो 1-2 दिन में नहीं होगा ये, और ना ही ये 1-2 बार के फीडिंग से होगा। आपको रेगुलरली ट्राई कराना होगा जिससे आपका बच्चा ब्रेस्ट पे आने लग जाए। नेक्स्ट क्वेश्चन इज फ्रॉम शिफ्टार. I had reduced bottle feeding to 5 times, but now she has started crying horribly at breast and stopping only on giving bottle. I think she wants fast flow of breast, 12 weeks baby, 5.25. So Shiftar, I just answered this question, the same thing, that how to improve the flow of the milk. So if your baby is getting used to the bottle, then obviously you have to improve the flow of your breast so that the baby starts getting the milk from the breast and in a better way, and follow the other tips which I just told you, like the baby should not be very hungry when you are putting the baby on the breast. Second thing, you should maintain some flow in the breast so that there is proper milk once the baby starts coming on the breast. Next question is from Alankriti. My baby does not delatch herself growth spurt के time से पहले से ही, and baby birth weight gain के कुछ tips दे. My baby is on breastfeed only. She has gained 100 grams only from birth weight in 6 weeks. Yes, Alankriti, I just told you, from birth, if she has gained only 100 grams, Alankriti, this is not good, Alankriti. You have to definitely work on improving her weight. Weight should be 200 grams per week. तो अगर 6 वीक्स का बच्चा है आपका तो 6 to the 12 1.2 kg वेट गेन होना चाहिए था भाई उसका, अलंकृति। बच्चा baby is on only breastfeeding 100 grams till now, till 6 weeks. This is definitely you have to increase her weight. Please work on improving your supply, or you have to work on giving her more hind milk. And definitely 100 grams for 6 weeks, 100 grams weight gain for 6 weeks baby is definitely, you need to work on this, अलंकृति। ग्रोथ स्पर्ट हो चाहे ना हो, 6 हफ्ते के बच्चे का वेट 100 ग्राम्स अगर बड़ा है बर्थ वेट से, Definitely, Arankiti, don't waste time. Please reach out to the team tomorrow. Get an appointment from me or my team and get this resolved, Arankiti. Anonymous attendee, how many days can we store the express milk? I just told you it is about 3 to 4 hours at room temperature, 3 to 4 days in refrigerator, and 3 to 4 months in freezer. If your freezer is not getting opened regularly, and also if the electricity supply is good, then aram se 4 to 5 months is fine. But if you have like electricity ka problem rehta hai, and also your freezer is getting opened, then it may be less than like 3 months or 4 months. And Mary says, my breast milk has more foam milk even after Moringa and Lactomagic. So, and Mary, that is okay, but what is the weight gain of your baby per week? That is more important. It's not about foam milk or hind milk. You have to tell me what is the age of the baby and what is the weight gain per week. Anonymous attendee, is skin to skin contact helps baby to come back to the breast? Yes, definitely. So what you can do when you are burping your baby, that time just you can open your chest, open baby's clothes, and keep the baby skin to skin with you. That will definitely help you to bring your baby back to the breast. Questions from the live. So 1 hour mein to first this is done. I will not be taking the questions which are already I have already answered. I'll take the questions which are new. I can see mostly the old questions. Good to see so many of you are live. So, Anne Mary says, my baby's weight gain is 100 to 150 grams per week, and now baby is 11 weeks. So 11 weeks baby, right now growth spurt is going on, and so during growth spurts, you might see the milk supply little, you might feel the milk supply is less because the baby is having growth spurt, and during growth spurt, the demand increases. If the baby is gaining 100 to 150 grams during growth spurt, it is definitely okay. After 12 weeks, just see the baby should gain around 100 to around 150 grams per week. That will be definitely good. And for now, also just do one thing. After every breastfeeding, just press the breast and see the color of the milk. If the color of the milk is thick white, please definitely like hand press and give that milk to your baby. That will help to increase the weight of the baby. Okay, so these are the questions. So I can see a lot of people are live there, and many of you are here. So I don't see any new questions coming up. So it was good chatting with all of you live. Okay, so I hope the session was helpful for you all and it answered your questions. I just go live usually every Friday. So you can ask your questions next time. And Anne says, my breast milk is always light. So, and if it is basically right now because your baby is on growth spurt, so just work on improving the, as you said, that breast milk is always light. But during growth spurt, if your baby is gaining 100 to 150 grams, it is fine. And if you're still worried, just reach out the team. They might be needing to change your dosages. So once the dosages are changed, the milk supply will definitely improve. So Asma says, my baby is 1.5 months old. He starts crying whenever I take him on the breast. So I already answered Asma. I have already seen this. That's okay. That's okay, Asma. If you are giving top milk and breast milk, it is definitely fine. Okay, girls. So I'm done with today's question. Today, for the first time, I tried this going live on 3 platforms together. It was my mother's community on Zoom and on Instagram and on YouTube. So I'm not a very tech-friendly person, but trying to learn the tech-friendly things so that I can help more and more of mothers. And Asma, मुझे आपके questions नहीं दिखे बच्चे. Please, if you can copy them and write them again. Because you said tips for bottle feed to baby, I answered. You said bottle feeding and drip feeding, I answered. You said both top milk and breast milk through bottle and he has colic issue, I already answered, Asma. I've answered all your questions. So, girls, as I was telling you, I'm trying to learn the different tech-friendly because See, I am a medicine person. I'm from medical background. I'm not very aware about the technical things, but slowly learning it and trying to be more helpful. Like trying my best to have more interaction with you all, so that can answer all your questions. Previously, I was taking Q&A for the community, mothers community. I have a beautiful community of mothers. So many mothers are live here also. So I love to take the community questions, but then I thought of like going live on Instagram family and YouTube family also. So yes, Asma, she's saying thank you from YouTube. Thank you for ma'am for answering my questions. Love you, Asma, and love you all of you. So I love answering the questions, and many times I see you all are new moms having a lot of questions. So I try my best to help you out, but definitely you can reach out to me for one-on-one consultations. Also, you can reach out to the team tomorrow, and my team is working from Monday to Saturday from 9 a.m. from 10 a.m. to 6 p.m. And you can book a consultation with me. And even I have 3 more doctors in my team whom I have personally trained, and they are also helping so many mothers. So because definitely there is some wait period, because we are dealing with so many mothers, that's why I'm coming live once in a week to answer your questions if you're not getting consultation time slots. So don't worry, I'm there. Don't worry, girls. I'm trying my best to be helpful for you all, and I'll keep coming to you regularly now, because I have this first session. I tried to be live on Instagram and YouTube together along with my mother's community on Zoom. I'll keep trying to do regularly. Thank you so much. And I can see one last question here from Amulya. My baby is into 4th month and she has completely stopped formula from past 2 months, and she weighs 6 kg. But still, I feel if milk is sufficient, please suggest. So Amulya, so first of all, congratulations, your baby was on direct exclusive breastfeeding. So first of all, don't worry. Your baby is 4 months old. You just check the baby's weight once in a week. If your baby is gaining 100 to 150 grams, then definitely it's completely okay, and you are doing so good. Don't doubt yourself. You're a lovely mother. You're an awesome mother. Just don't worry. You are doing so good. So Asma says, please keep the live on YouTube so I can see afterwards. Definitely, Asma, I'll try my level best to go live on all the channels regularly. So good to have you all. So any other question in the Q&A box? Let me see. Anne says, thank you, ma'am. Thank you. Most welcome. Nisha says, my nipples pain a lot during breastfeeding. What to do? Nisha, I answered this question, the same question. Nipples pain a lot. That means your latching is not correct. You are doing a shallow latch. So Nisha, go through this recording again. I have answered how to improve the latch. You can definitely go for that. Vani says, we love you, ma'am. I love you too, all of you. You all are my beautiful moms. You all my awesome moms. And definitely a big love and big hug to you and your babies. So Amulya says, thanks a lot, ma'am. You're awesome. Thank you so much. Madhuri says, thanks for the live session. Anukripi Kipari says, do you take Garbh Sanskar classes? Yes, yes, girls, no. So this is an announcement. I used to take Garbh Sanskar classes around 2 years back, but then I got so busy with the breastfeeding consultations that I stopped doing Garbh Sanskar classes. But now, girls, so we have started our Garbh Sanskar classes again. But yes, I hope you all understand that now as I'm growing old, so so definitely sometimes I struggle with the time. So I'm training most of my doctors one by one. So now they are all ready to take Garbh Sanskar classes. And believe me, the classes which we have designed now, they are weekly basis and they are awesome. The matter which we have created for Garbh Sanskar classes is very good. So you all can definitely join our Garbh Sanskar classes, and we are trying to inculcate lot of good values for your unborn baby. And if this is your second pregnancy, it will definitely help your elder one also. So this way you can join the Garbh Sanskar classes. And if you are pregnant and if you are on your third trimester, then you can reach out to me for the breastfeeding preparedness session. I will prepare you all on how you can Asma ma'am, when can will you? I'll be mostly next Friday. I'll be live. So I was talking about the breastfeeding preparedness class. So breastfeeding preparedness classes are very important, where I teach you what you can do during your pregnancy so that your breastfeeding journey from the starting itself will be very good. So this way you can join the breastfeed. Like, it is just one session where I need to just let you know what you need to do during your breastfeeding, and first 5 days of after delivery are most important, because that is the correct start, and if you are doing the correct start, your breastfeeding journey will definitely go very well. So I remember one of the mothers, she joined my breastfeed, like she consulted me for breastfeeding preparedness during pregnancy, and when her child was delivered, she didn't need the help of any of the nurses in the hospital. She knew what to do, and the nurses were so surprised. They called the other mothers to show that how beautifully she was breastfeeding her newborn, and everybody was so proud of her, even her family members. She sent me all the pics. It was lovely seeing her so confident in breastfeeding her baby from day one, and she told all of the nursing staff and all the doctors that without my consent, please don't give formula milk. This all I taught to her, and I was so happy to see my beautiful student going there. So this way everything was so well, and I definitely want every mother to take that control, that they should be so confident about breastfeeding that they can take the whole whole control in their own hands, that they should be knowing that what has to be done, and all the things related to breastfeeding. And I can see a lot of knowledge gaps in breastfeeding, specifically lactation. So I need all of you to be so knowledge aware, and you can help the other mothers too. So last few questions, because I'm getting the questions like regularly, but I am loving this to have the questions because I love to answer questions. So Sunita says, मैम मेरी बेटी 2 महीने की है, लेकिन वो ब्रेस्ट फीडिंग कराने के बाद भी रोती है, खेलती नहीं है, तो मुझे लगता है कि उसका पेट भरा है कि नहीं। तो सुनीता, आपकी बच्ची 2 महीने की है, बच्चे का वेट देखो। अगर बच्चे का वेट 200 ग्राम हर हफ्ते बढ़ रहा है तो आपको कोई चिंता नहीं करनी है। लेकिन अगर बच्ची आपकी रोत रही है लगातार, तो मुझे ऐसा लगता है कि उसका वेट कम बढ़ रहा होगा। उसको आप एक बार बच्चे का वेट चेक करो और देखो कि क्या हो रहा है इसके अंदर। Anukripi says, what are the charges? So you just reach out to the team tomorrow and you can get all the knowledge from them. You can DM me. I'll send you the helpline number, the inquiry team's number. So all of you, would be knowing I have a team of around 10 girls who are working in our clinic, who are regularly there to help mothers. And we have team of 3 doctors more who are working regularly every day to help out a lot of mothers. So Anukipari says, thank you, ma'am. Most welcome. Here also I can see that Alankriti says, thank you so much, ma'am. Mrs. Akram, thank you so much, ma'am. I hope I can do it. Thank you so much. Yes, Mrs. Akram, you can definitely do it. Don't worry. And anonymous attendee asks, ma'am, is breastfeeding possible with inverted and flat nipples? Yes, definitely. So inverted and flat nipples, you have to go have a proper latching technique, and cross cradle helps a lot. And you just need if you have any problems, you can reach out to our latching expert. She will go live with you with your child and can help you with breastfeeding your baby with even inverted and flat nipples. So, okay, girls, I am not seeing new questions. Before that, I start getting more questions. Let me take a bye to all of you. We'll connect with you all next Friday again. So take care, everyone. Have a very good night, and take very good care of yours and your babies. Yes, Anukipari, you can message me on DM. I'll send you the team's number. So take care, girls. Bye-bye. It's good to say bye from here. All the 3, I can see my hands moving on all the 3 screens. So I'm learning, I'm becoming tech friendly every day. That's great. And it is always possible because now I have a team of girls, like team of doctors who is helping, so that I can spare my time and getting on more platforms to help more and more mothers. So that is definitely my way of giving back to the society. And I know how much I suffered when during my first child, I was not getting any help for breastfeeding. And that time I realized that there is so much gap for breastfeeding. And this I'm talking around a long back, but I feel the same thing is happening even now. Mothers are not aware of there is a lot of knowledge gaps in that. So that's why you girls need to do regularly your knowledge updates and keep coming live. You can keep asking questions. I'll try my best to answer you all. Okay, not taking more time, going off one by one, how to do off from here. This is the way. Yeah. And let me stop this one. And now, and my home community is here. So so this, I have stopped all the streamings. And girls, I hope you all know that today went live on the all 3 channels, and it was a beautiful experience because I could see a lot of questions coming from YouTube, coming from Instagram, and you all. But I am very happy that you all have been so patient and like gave me time to answer them one by one. Thank you so much, girls. Have a again good night. Bye bye. Take care. Love you all.